My name is Kylie. I am going to be doing the skill of a head-to-toe assessment on my patient. He is a simulated post-surgical patient for a septoplasty. So to begin my skill, I would knock on the door, and then I would enter the room, close the curtain behind me for privacy, perform hand hygiene. Hi sir, my name is Kylie. Can you tell me your name and date of birth?
Larry Navarro, March 25th, 1993.
Perfect. I would then verify his wristband. It in fact is him. Can you tell me why you're here today?
Septoplasty.
Septoplasty. Good. So you had your septum repaired.
Yes.
Perfect. Are you experiencing any pain right now?
No.
Perfect. Do you have any allergies?
No.
Okay. So I would go ahead and begin doing his vitals. While I'm running his vitals, I'm going to ask him a series of questions. Vitals would be heart rate, blood pressure, respiratory rate, O2, and heart rate. Can you tell me why you're here? Or can you tell me where you are? I'm sorry.
Hospital.
Okay, and can you tell me what year it is?
2025.
Perfect. So he is alert and oriented ×4. His GCS is going to be 15, which means he's fully alert and responsive. His overall appearance is healthy, which means I'm seeing no signs of acute distress, no deformities or irregularities. His color looks good, no signs of paleness or discomfort. He has good hygiene. He's cleaned, washed, and his is well groomed. So what I'm going to be doing today with you is a head-to-toe assessment, which essentially means I'm going to be starting from your head and working all the way down to your toes, making sure that everything looks good. Are you comfortable with that?
Yes.
Perfect. So when I'm doing his assessment, I want to make sure that I'm not touching too much around the surgical site. So when I get to his nose, I will verbalize what the findings should be or would be instead of actually performing them. So I'm going to go ahead and start with the eyes. First appearance of his eyes is that they are symmetrical. I'm going to go ahead and gently pull down on your eyes. Perfect. The conjunctiva is pink and moist and the sclera is white. I'm going to go ahead and check your pupils. So go ahead and look straight at me. Good. They are reactive to light. And go ahead and watch my finger and show accommodations. So pupils are equally round and reactive to light, and show accommodation. Are you having any issues with your eyes lately or anything you're seeing?
Oh,
no?
I do not have any issues.
Okay, so next thing I want to do is assess your vision. So I'm going to stand 10 feet away for sake of space. I don't have 10 feet, but this sign would be 10 feet away on the wall from the patient. Go ahead and cover one eye. Good. And can you read the fourth line for me?
LPED.
Good. Can you cover your other eye? Can you read the fifth line for me?
PECFD.
Perfect. So using the Snellen test, I would have assessed his vision. Vision is accurate. No signs of concern there. Next thing I'm going to do is look at his nose. So I'm going to check the surgery site and make sure there's no excessive signs of bleeding or bruising. Looks good. From what I can see, his septum looks like it's midline. His nares look symmetrical. If I could see inside, I would be assessing to make sure they're patent and they're not bloody or overly dry. Do you have any issues with your smell?
I do not.
Good. So I would assess his smell or make sure that he's not having any issues with his smell. I'm going to gently palpate his sinuses. Do you have any tenderness through your sinuses?
There is no tenderness.
Okay, no pain through his sinuses. Are you in any pain today at all?
No, I am not.
No. Okay, so pain would be a 0 out of 10. And I would make sure that if I covered to test his septum, I would cover one nostril and have him breathe and then cover the other. Obviously, I'm not going to be doing that if he had just had a septoplasty. Okay, we're gonna go ahead and move on to your mouth. So I'm gonna have you open your mouth and say ah for me. Okay, so no signs of ulcers or cuts. Uvula is midline and rises and falls symmetrically. Tonsils are back there, pink and moist. Teeth look clean and intact. Gums are moist. Lips are pink and moist, show no signs of cracking. Do you have any issues in your mouth or in your teeth? Any pain there?
No.
No? Perfect. Next thing I'm going to do is move on to looking at your ear. So I'm going to gently palpate his tympanic membrane. Do you have any pain through here?
No.
No? Okay, I'm going to check behind the ears for any skin breakdown. There is not. I'm going to look inside the ears and make sure that there's no excessive wax buildup or drainage or bleeding. His ears do not have any of that. I'm going to go ahead and whisper 2 words to you. I want you to repeat them to me. Orange cat.
Orange cat.
And on this side, red truck.
Red truck.
So you can hear on both sides. I obviously would whisper those quieter if I was testing in person, but for sake of you hearing, I didn't. So ears look good. And then from there, I'm going to move on to his neck. So I'm going to assess his carotid pulses, which are going to be down here, and make sure I can feel on both sides. They are +2 bilaterally. Temporal pulse is +2 bilaterally. Can you please swallow? Good. Trachea and thyroid, everything feels good down through there. After that, I'm going to go ahead and palpate down here. Is there any pain through here?
No.
No? Okay. Can you go ahead and move your neck in a full circular motion for me? Any pain when you do that?
None.
Okay, go ahead and shrug your shoulders. So I'm pressing a little resistance to test shrugging shoulders with resistance there. Any pain when you do that?
No.
Perfect. Can you go ahead and touch my finger and then touch your nose? Good. Touch my finger, touch your nose. Good. So patient's coordination is present. No signs of that there. Next thing I'm going to do is move on to listening to your lungs. So initial assessment of breathing. Patient shows no signs of labored breathing or use of accessory muscles. Obviously, if I was to be doing this on a live patient, I would want to make sure that I'm getting under the skin if possible. For sake of the simulation, I'm going to stay on top of his clothing. So I'm going to listen to your lungs. I'm going to listen to 6 different spots. Breathe normally, please, or breathe deeply, please. And go ahead and sit forward and listen to your back. Same thing, breathe deeply. Good. Lungs are clear with no irregularities or no adventitious sounds on posterior and anterior. Next thing I'm going to do is go ahead and listen to his heart rate in all 5 areas. So I'm going to go ahead and listen to your heart now. You can breathe normally for this one. Lift your arm. Good. Heart has normal rate and rhythm. S1, S2 are audible. Are you having any chest pain or anything when you're working out or day-to-day life?
No.
Nope. Any issues with your respiratory, breathing, coughing,
No.
sneezing? Good. Okay, so now I'm going to move on to assessing his skin. So looking at his arms, I'm looking for lesions, lumps, scarring, bruises. His skin shows normal or good turgor with no tenting. I'm going to go ahead and check capillary refill, so slight squeeze. Capillary refill is less than 3 seconds. Can you look away and tell me which finger I'm touching?
Pinky.
And which hand is that on?
Right.
Okay, perfect. I'm going to look at this arm, nothing irregular on this side. Same thing, can you tell me which finger I'm touching?
Pinky.
Next thing I'm going to do is I'm going to touch you with a sharp and a dull object. Can you tell me, without looking, if this is a sharp or a dull object?
Sharp.
Good. And
Dull.
good. So capillary refill is less than 3 seconds. Skin shows no signs of tenting. It is warm to the touch, not cool or clammy or pale with any lumps or lesions on it. I would continue this all the way down the body from what I could access. As I move on to legs, I want to check for any edema or swelling. I'm also going to assess for pulses down here on the feet, on both sides. Good, both sides of the pedal pulse are +2 bilaterally. I'm going to go ahead and do a gentle squeeze. Good. Capillary refill at his feet is less than 3 seconds. I'm going to go ahead really quickly and check your pulse on your arms as well. And pulse rate is +2 bilaterally as well. Skin, what you're looking for is any breakdown on bony prominences. So on his elbows, on the back of his heels, or on his sacrum, back of the head if they're bedridden. In this case, no signs of dryness or cracking or skin breakdown. Next thing I'm going to do is go ahead and assess your abdomen. If you could lay down. Good. So first thing you do when you're assessing abdomen is I want to make sure it doesn't appear distended or overly rounded. No distension is present. I'm going to go ahead and listen to your bowel sounds starting in the lower right quadrant. Bowel sounds are heard in all 4 quadrants. If for whatever reason I didn't hear a bowel sound, I would wait for 5 minutes to see if I would hear it, and if I didn't hear one, I would definitely want to notify the healthcare provider. I'm going to go ahead and palpate. Let me know if there's any tenderness as I do this. No tenderness? Good. Have you had any issues with bowel movements or urination?
No.
No? When was your last bowel movement?
Earlier today.
Good. Any discharge from your penis?
No.
Nope. Good. Any burning when you go pee?
No.
No. Good. So patient denies any irregularities with bowel movements or urination, which is good. Okay, I'm gonna go ahead and check your feet for strength. So if you could push into my hand, good, and now pull. Good, same thing, push and pull. Any pain when you do that in your joints? No. Okay, go ahead and bend your knee. Any pain when you lift up your knee?
Nope.
Okay. Go ahead and pull your heel towards your butt. Good. Now go ahead and push up. Any pain?
Nope.
Okay, other leg. Go ahead and pull your heel towards your butt. Good, now push away. Any pain when you do that? Nope. So strength in his lower extremities is fully present and equal on both sides. You can go ahead and sit up if you would like. Good. Go ahead and put your arms up like this. Go ahead and push towards me. Any pain when you do that?
Nope.
go ahead and pull towards yourself. Any pain when you do that?
No.
Good, go ahead and push in. Any pain?
No.
And push out.
No.
No pain. Patient shows equal strength on his upper extremities as well, with no pain. Next thing I'm going to do is make sure that he has full range of motion in those joints. So go ahead and move your wrists in a circle. Good. Go ahead and move your ankles in a circle. Awesome. Okay, do you feel comfortable standing up and taking a couple steps?
Yes.
Okay, go ahead and stand to the side of the bed. Go ahead and stand. Do you have any signs of dizziness?
No.
Nope. Go ahead and take a couple steps forward. And turn around and come back. Good. Can you stand and touch your toes? Good. You can be seated if you want. Patient shows an even, steady gait, full range of motion, and strength through his back. Do you have any pain when you walk or bend?
No.
No pain when he walks or bends. I think this concludes our assessment. Do you have any questions for me?
No questions for you.
No? Any pressure in your nose?
No.
Nope. Good. So if you have any excessive bleeding or anything that comes up, be sure to let me or a healthcare provider know immediately. Can I get you anything before I conclude the assessment?
No, I'm okay.
Okay. Are you in a comfortable position?
Yes.
Okay, so I would make sure patient has his call light and is placed in a comfortable position. I would remove my gloves, take any supplies that I have with me, I would perform hand hygiene, and then I would exit the room. I don't think there's anything I would change with the assessment. The only thing I would do would be sure to assess pain level earlier in the assessment. And then that would conclude my skill video.